Hey everybody, I want to try a new thing of a POCUS or point of care ultrasound case of the week. This first patient is young, healthy guy in his 20s, coming in here with right-sided testicular pain for one day. So the first question we ask ourselves is this testicular torsion? So I grab my ultrasound, put it on the linear probe, and I am scanning the affected testicle. Here I'm in a long axis orientation, and I'm putting a color wave Doppler, putting a big box right in that middle of that testicle. What I'm making sure I see is good vascular flow throughout the testicle. Here, the directionality, so the blue and the reds don't matter as much as long as I see good color. If this was torsion, you would see one testicle basically without any vascular flow. If you wanted to be like radiology, you can actually quantify the flow by putting a pulse wave Doppler and measuring the resistive index of that flow. We can talk about that in a different video. I forgot to mention on the exam, he was quite tender on the posterior aspect of that right testicle. So here we're actually seeing kind of the long axis of the epididymis, which is at the right side or the posterior side of the testicle. You can see here that the right one, the symptomatic side, is much larger than the left one. So then I went back to that same view and I put color on it. And as you can see, that right side is exceptionally hyperemic. There is tons of color flow and blood flow going to that epididymis compared to that left side. And these are actually on the same color settings. So clinically, this is not torsion, but instead epididymitis. In this case, because he's young, sexually active, the most common calls are going to be your STDs. So this patient got the ceftriaxone, doxycycline, counseling about wearing a condom, and then obviously treating his partner. Hope you enjoyed this little quick learning tidbit on POCUS, and hope you can use it in your practice.